look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
You hear a dentist discussing booking problems with her receptionist.
Hey Kieran, Mr. Lau just mentioned that he'd tried to reschedule his appointment yesterday, first online, and then when that didn't work, he called up. But apparently he couldn't reschedule. Any idea why?
I wasn't working yesterday, but let me check the notes. So, Lana left a note about the call. She says that Mr. Lau wanted to reschedule, but we didn't have any other appointments this week after 3 p.m., which is the only time he could make. He asked if he could make an appointment next week, but his procedure was marked on our system as urgent, so she had to make it in the same week. The system wouldn't have let her reschedule it any later. She wouldn't have had the authorization to change that. Still, she should have discussed this with you at lunch or at the end of the day, because then you could have decided whether it could have been postponed for a week.
Yeah. In his circumstance, it would have been fine to reschedule at a slightly later date. We should prevent something like this from happening again.
You're right. I'll talk to her about it tomorrow, and I'll send out an email to everyone else so that they're aware.
You hear a doctor discussing chest X-ray information with a medical student.
Hey, Dr. Yan, we've got the x-rays back from Mr. Regis in bed 8 from this morning.
Great. Can you document them in the notes?
Do you mind showing me how to write the interpretation properly?
Of course. Make sure you put the patient details. Full name, date of birth, patient number, and home address first. Then put the hospital and ward, date, and time. Make sure your name is on the document too. Include the indication for the x-ray like hemoptysis or dyspnea before documenting your interpretation. Now, I use a simple mnemonic to make sure I don't miss anything. A, B, C, D, E. Airway, trachea, carina, bronchi, and the hilar structures. Breathing, lung fields and pleura. Cardiac, heart size and heart borders. Diaphragm, position, shape, and costophrenic angles. Finally, everything else, the mediastinal contours, bones and tubes or devices. Make sure you document everything clearly using this system in the notes.
You hear an ENT surgeon talking to a colleague about cochlear implants.
We implant an electrode array which looks like several small wires made of a platinum iridium alloy into different regions of the cochlea. These metal wires conduct the electrical impulses generated from the microphone, which picks up sound from the environment and sends the signals to the electrode array through a transmitter. There's also a speech processor between the two that filters more important sounds so that the patient can hear people talking rather than other sounds.
Right, okay, so does this restore hearing to normal levels?
No. With the current technology, we're giving deaf people a good representation of sounds from the environment and help to understand speech. After surgery, patients undergo therapy to relearn the sense of hearing. not everyone benefits from the device to the same extent.
Right.
You hear a GP talk about type 2 diabetes mellitus.
Hello. I'll be covering the diagnosis of type 2 diabetes mellitus. So there are 4 methods that we can use. The first is a fasting plasma glucose test. This is our preferred diagnostic test, as it's easier to carry out, often more convenient, and costs us less than the other 3 tests. It helps to try and book these appointments in the morning, as the patient has to refrain from eating for at least 8 hours before they can take the test. Normal fasting blood glucose will be between 70 and 100 milligrams per deciliter. A value of over 126 milligrams per deciliter indicates a diagnosis of diabetes. Bear in mind that this test should be carried out twice to confirm a positive result. The second method we can use is to measure the average glycemic load over the past 3 months.
You hear a dentist talking to a patient with a chipped tooth.
So we've talked about different options, and it seems like a veneer would be the best treatment. Given the cost of the procedure, are you happy to go ahead?
It's quite expensive, but I definitely need to get it fixed. Will it stay put?
Veneers tend to need replacing every 10 to 15 years, so they are a long-term solution. It will certainly be more durable than composite bonding, and it will look more realistic too.
Oh, okay. That's great. And is there anything I can do to extend their lifespan?
Well, you need to maintain good oral health. You know, brushing, flossing, regular checkups. You should avoid brushing your veneer too hard, as it could cause damage.
Okay.
You hear a podiatrist talking to a patient with fallen arches.
So, you say you're experiencing foot pain. Are you wearing supportive shoes?
I'm wearing appropriate shoes, and I'm also wearing orthotics that should be helping, but I'm still experiencing pain in my feet. Sometimes they feel a bit numb too.
Right, okay. And you mentioned that you've been given some foot exercises to do?
Yeah, the physiotherapist I went to showed me those. At first I thought they were helping, but now I think I'm as bad as I've ever been. Is there anything else we can do?
That is the end of Part B.